Hey, I'm Dr. Matt, LifeWorks Integrative Health, and today I want to go over the causes of peripheral neuropathy. So peripheral neuropathy is a disease that's associated with damage to the nerves. But where a lot of people are making the mistake with peripheral neuropathy is they're only believing that it's a one issue, which is the nerves. And I want to show you today that peripheral neuropathy is actually much more complex than just damage to a nerve. It's actually damage to the vascular system as well. And when we get into the causes of the neuropathy, you're going to understand why the damage to the vascular system then ends up leading to this miscommunication that's happening with the nervous system. So when we look at the top causes of peripheral neuropathy, the number one cause is diabetic patients that have diabetes or pre-diabetes. Now, just do yourself a favor. If you've been told you have pre-diabetes, just consider yourself a diabetic and take massive action steps to reverse that blood sugar and really control that. One of the best things you can do is just start getting rid of processed foods, get rid of the sugar, get rid of the diet sweeteners, and really just get down to what we call like a paleo or a ketogenic type of diet. 30% of the diabetics will develop peripheral neuropathy according to the literature. Second cause is lack of microcirculation, okay? So vascular circulation to the periphery of your body, to your hands, to your feet, to the periphery of the organs. Now, if we think about this, diabetes is actually destruction of the vascular system. So it destroys the microvascularization that's in the hands, the feet, even in the eyes and in the kidneys, which is oftentimes why you see diabetics develop kidney challenges or even go blind, lose limbs, and lose the feeling in their hands and their feet because the microcirculation is gone. And our body needs this circulation to provide nutrients to those areas for healing, for growth, and then it also needs it to get rid of waste in our body. The third cause is toxins. What kind of toxins are we talking about? Well, 30% of the people who have received chemotherapy will develop a peripheral neuropathy as a result of the damage and the toxicity from the chemotherapy. There's a percentage of patients that have been involved with the Vietnam War and Agent Orange. And there's another toxicity that I don't believe people are really considering today, and this is the toxicity of having too much sugar in our body, right? So sugar is a toxicity to our body that creates acid and also leads to diabetes, but it breaks down that microvascularization, which is feeding our nerves so they function well. The fourth is back or neck pain or disc issues, or surgical, where it's actually stemming centrally from the spine. This is probably going to be less related to vascular issues and more related to traumas or injuries or just simply wear and tear of not taking care of your joints, your spinal joints properly over the years. The fifth here is autoimmune disease. Now, autoimmune disease is becoming way more common today than ever before. Autoimmune disease is when your body is like putting an attack against normal healthy tissue. So some of you have heard of like Hashimoto's thyroiditis, type 1 diabetes, scleroderma, even eczema can be an autoimmune issue. Many allergies that people have today are autoimmune challenges that are developed. Celiac disease is an autoimmune issue. It's when your body is now beginning to attack itself. This creates an inflammatory reaction, and this inflammatory reaction in turn is going to affect the microvascularization within the body. Nutritional deficiency, another big thing. When people aren't getting the nutrients to their nerves, they begin to die off. And again, that kind of ties back to being able to get the nutrition to the nerves and to the through the vascular system to that area. The seventh is alcohol abuse. Those that drink too much alcohol have a high likelihood of damaging the vascular system as well as the nerves in the body. It will cause deficiencies in some of the vitamins, the B vitamins, which your nerves need in order to function properly. Liver, kidney, and thyroid disease can also create inflammatory reactions in the body and increase the likelihood of peripheral neuropathy. Infections and several medications that are out on the market today. Actually, I really shouldn't say several medications, I should say a lot of medications on the market today cause damage to the microvascular system, which can lead to peripheral neuropathy. Now, I want to also go through with you just the basic physiology of kind of how peripheral neuropathy, how your body works with those nerves. So, you see, your brain is sending millions of messages down the spinal cord every single second of the day. And then it exits the spinal cord through these big nerves right here, these large diameter nerves. Well, these large diameter nerves then go into what I like to just say real simply, it's a ganglion, but it's like a junction box. It's like a junction box on your wall where you plug in your microwave or your TV, your refrigerator, or maybe your computer, right? And so this junction box, from here, there's small little nerves that exit that go to the periphery of the skin. And these damage to these is what's creating the peripheral neuropathy. When these become damaged, they start to send incorrect signals up to the brain. These incorrect signals are painful. They can feel like numbness, tingling, burning, sometimes stabbing pain. It could be hot, it could be cold, so it can give you a number of different sensations. Now, our current treatment today for this, unfortunately, is taking different drugs like gabapentin, Neurontin, Lyrica, and they don't work down here on the nerve. They actually work up in the brain, blocking those pain signals and slowing your brain down so you don't perceive them as well. So really, when we're thinking about peripheral neuropathy, the piece that gets missed many times is this guy right here, okay? What does that look like to you? Does it look like some microvascularization? And so these micro blood vessels that are feeding these nerves begin to die off. And so we really need to develop a treatment, okay, like we have in here at LifeWorks, to address the regrowth of these blood vessels to supply the nutrients back down to those nerves. So if you're challenged with peripheral neuropathy and you're taking a medication for it, you want to think again. And the reason why is because the real challenge is down here with the vascular system getting down and feeding those nerves so they begin to heal and function better. So if you've learned anything from this video, or you think somebody else could benefit from it, be sure to like it, share it with somebody you know, because there's so many people out there today that are developing peripheral neuropathy that could be prevented, or we can start taking action steps to reverse some of the damage that's going on in there. We look forward to teaching you more, and check us out on our website.